Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and this week we'll be here each day, Tuesday through Thursday at noon for this update. This is update number 51 is coming to you live on May 26, 2020. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthInfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. And today's participants joining Matt Muratore and me include Dr. Barry Potvin and also Sarah Cloud, Stephen Cole, and Michelle Bratti. And at this time, we're going to begin. And today, Sarah is going to talk to us about masks. And she's going to talk about how to communicate to us. And Sarah, welcome. Sarah is the Director of Behavioral Health and Social Work at Beth Israel Deaconess in Plymouth. Welcome, Sarah.
Thank you. Thank you for having me. I know that masks are not really a popular topic. So I know there can be a little bit of a sore subject. We've talked in previous episodes about tan lines on the beach and whatnot on your face. So I know it's not popular, but I think, like it or not, it would appear that masks are going to be around for a while and to stay. So in addition to creating a much needed barrier for the transmission of germs and keeping us healthy and safe, they also pose a barrier to communication. They muffle your voice and they hide the expressions, the facial expressions that are really important in terms of communicating. So we rely on visual cues such as facial expressions and lip reading to understand what people are saying. So, for example, the difference between a serious statement and a joke is often a smile on your face or the tone of your voice, and the masks create a challenge in communicating that. So, how you communicate is just as important as what you communicate. So, there's this concept out there that some folks might be familiar with. It's not scientific or set in stone, but it's this interesting concept I was hoping to talk briefly about. It's called the 7-38-55 rule. So, the concept about the communication and using emotions. So, the rule states that only 7% of the meaning is communicated through spoken word, 38% is through tone of voice, and 55% is through body language. So, in other words, communication under this concept is 7% verbal and 93% nonverbal. So, ways to improve mass communication. Um, so, first of all, we want to make sure that we're not pulling down our masks to communicate because that just kind of makes it null and void why we're wearing the masks. I know I've certainly seen a lot of folks out in public trying to communicate better and they pull it down and the other person steps back quite a bit of distance. So don't remove your mask to speak. It helps to get the other person's attention by saying their name or gesturing to them. You want to make sure that you have good eye contact and that you're facing the person that you're speaking to at a safe distance. Before you begin, make sure they can hear and understand you. Wearing a mask reduces your vocal level by 17 decibels. So, to put that in perspective, a mild hearing loss is anything above 20 decibels. So, it really does impair the travel of sound. Speak in a normal or slightly slower pace. Speak slightly louder but natural. Do not yell or over enunciate. And use shorter everyday phrases and words. And rephrase rather than repeat what is not understood. So, body language and hand gestures and postures are also vital to meaning and effectiveness in terms of communication. Your nonverbal cues should send a message of kindness and empathy. You can convey this by relaxing your shoulders, try not to cross your arms in front of your body, try to keep your hands off your hips and out of your pockets, and nod when appropriate to communicate that you are listening and understanding. You can also use your eyes and your eyebrows. Good eye contact is very important. Let your eyebrows tell a story. Happiness can be seen by raising eyebrows, raising your cheeks, eyebrows pinched together, and eyes drooping can indicate sadness. And eyebrows in a V can convey that you're angry or frustrated. So, as wearing face masks becomes a new normal, not only for healthcare workers, but for everybody, navigating life it's really important to communicate effectively while wearing one. Thank you.
Sarah Cloud is the Director of Behavioral Health and Social Work at Beth Israel Deaconess in Plymouth. She is here to answer your questions. Email us at plymouthinfo@pactv.org. Each day we begin with a health segment, and today we're delighted to have two people to participate in that. Our second health segment participant is Dr. Barry Potvin, and Dr. Barry Potvin is a professor emeritus from Yeshiva University, Department of Biology, also the vice chair of the Plymouth Board of Health. Welcome, Barry.
Hi, Steve. Thank you. Hello to everybody else. I hope everybody had a good weekend. I'm going to have to be cautious of my body language, I guess. Anyway, I thought I'd start off today by responding to a question that came in last Tuesday about condominium pools. That was clarified at our most recent Board of Health meeting. These pools are considered stage 2, and they will be opening once we reach stage 2, but of course there'll be state guidelines about capacity and physical distancing. It may not open actually on June 8th. We don't know yet exactly when stage 2 will start. It's really dependent upon the data. Also, generally speaking, pool water is pretty safe as long as it's been properly treated with chlorine and bromine. It's known that the coronavirus can't survive in that. Generally speaking, also thinking about beaches and being outside during the holiday weekend, it's definitely safer to be outside where there's more air circulation than inside. The only exception to that, of course, is your own home and your own backyard. So I think probably everybody made ample use of that this weekend, since the beaches were a little bit on the cool side around here this past weekend. I've been thinking a lot about Stephen Cole's Mark Twain quotes, and I've been trying to find something that I thought was appropriate. And I came up with something that I actually told Dave Kindy about, something that I've been paying attention to for a long time. It comes from Mr. Spock, the science officer who was played by Leonard Nimoy on Star Trek. And I think it's especially relevant, and I always found it very useful. And it's just the quote is that the needs of the many outweigh the needs of the few or of the one. If you think about that for a while, it pretty much describes what we all should be doing under these conditions with the pandemic going on. And it applies also that when you make choices for yourself, it of course also affects other people, not just you. Among the other things I'd like to mention today, sort of briefly, is some positive news. There's a new experimental vaccine been developed in Britain. It's moving into testing phase, and it's going to involve about 10,000 or more people in the testing phase. So in terms of what we do in this country, that would correspond to a stage 3 testing, which is very positive. Hopefully it'll work, have no side effects, and be quite effective. There's also some information by 7-day averages that have come out. And this is quite important because it found that the number of COVID-19 cases has been decreasing in 10 of the 50 states. Those include Massachusetts and Connecticut. It's been staying the same in 22 other states, and it's actually unfortunately been increasing in 18 states. And generally speaking, after what you might have seen on the news this past weekend, you can probably guess which states those probably include. Cautions that you still have to think about. There was a new study from the Imperial College of London that was published a few days ago, and it found that 13% of the 6.9 million Massachusetts residents are already infected. Um, uh, it also found that as of the 17th of May, 96,000 of the residents in Plymouth, in not just Plymouth, but in Massachusetts, are probably still infectious. So it's out there, the virus is out there. Public health experts and epidemiologists are fearful of a second wave of infections. It's already happening in some countries. And it does look an awful lot like the 1918 flu pandemic. So you have to be vigilant, you have to be aware of risks. And above all, you probably have to use some common sense when you're trying to decide what you should and shouldn't do. Nationwide, but not in Massachusetts, thank goodness. There was a lot of risky behavior across the country, a lot of people not wearing masks, partying in very crowded conditions at beaches, pools, and raceways. And some of the things that you could see on the news was just really very distressing. So that's all I have for now. I'm hoping to leave enough time so that we can respond to other questions. Thank you, Steve.
Thank you. And that's Dr. Barry Potvin, Professor Emeritus, Yeshiva University, Department of Biology. And your questions can be sent to PlymouthInfo@pactv.org. Each day we date stamp our presentation. It's in the top right-hand corner. We're bringing you officials and experts in fields responding to the coronavirus. At this time, we're going to continue and welcome back on Tuesdays Michelle Bratti. She is the Director of Elder Affairs in the town of Plymouth. Welcome, Michelle.
Hi, Steve. Thank you so much, as always. And hello to the esteemed panel that I'm lucky to be with every week. Let's talk about something you can control, because there's so much we can't control these days. How about voting? Voting is something you, Plymouth, can control. Voting for our local town election is June 20th. This election is for select board members, town meeting representatives, and other various town seats. We encourage each and every one of you to vote and have your voice be heard. Every vote does count. The link for absentee ballot applications can be found on the town clerk website, www.plymouth-ma.gov, on our Facebook page, the Center for Active Living, and in our constant contact email. We encourage seniors to vote using the absentee ballot method for optimal safety, of course. If you do choose to vote this way, please get your absentee ballots in as soon as possible so there is no delay in them being processed in a timely manner. If you have any questions on this process, please call the town clerk's office, 508-747-1620, extension 10205. We know there was a little bit of confusion with the May 19th election, and we want to ensure, especially for seniors, if you're not comfortable going out to the polls, and again, for optimal safety, voting by absentee ballot, that you have plenty of time to do so. Our town is important, and who we elect as officials, as you all know, obviously is important. Just a reminder, the League of Women Voters has the 2020 Census Challenge. Don't forget to fill out that census. You can go to my2020census.gov. You could call 1-800-923-8282, or you can call Center for Active Living. I think you know our number, but 508-830-4230. We'll help walk you through it if need be. Plymouth is currently in 6th place out of 8. Not acceptable, Plymouth. Not going to work. We are not coming in 6th. We need to be number 1. 2 quick changes in food systems for our seniors and for Center for Active Living. The Nathan Hale Foundation, which I can't say enough, I can't talk enough about, is exceptional, has really done a fantastic job servicing seniors and veterans in this time of need and ensuring delivering to seniors that couldn't get out. They are going to be making their last senior deliveries on June 1st. They're still going to be open for food. They will continue to have pre-made bags of groceries for pickup. If you need us to pick that up for you for our seniors, please call us and let us know. We will gladly do that for you. They just have to stop the delivery process. And the other excuse me, I'm reaching forward. Isn't that nice? It's over here in my notes. The New Hope Chapel Food Pantry will now have a drive-through system. It's like McDonald's for a food pantry. It's great. Every Thursday, 9 to 12. No need to call. You can just show up, drive through. It's at 89 Court Street, and the driveway is to the left of the chapel. So that's all I have for today, Steve. Thank you.
Thank you, Michelle Bratti, Director of Elder Affairs for the town of Plymouth. She and the rest of our panel can answer your questions. Email us at plymouthinfo@pactv.org. Each Tuesday and Thursday, we're joined in our business segment by Stephen Cole. He's the Executive Director, Plymouth Regional Economic Development Foundation. Welcome, Steve.
Thanks, Steve. Glad to be here, especially on a seemingly sunny day, although I do see some fog rolling into the harbor. Anybody who's on the beach, I'm sure, might want to take some heed to what may be coming next. I, though, want to share with folks a quote, and why I think Dr. Barry's quote is so appreciable today is because the quote we shared, we selected for today is, "The future ain't what it used to be." Now, Yogi Berra was attributed with that quote, but I will tell you, after doing some deep research, I can tell you that in 1937, a French philosopher named Paul Valéry actually penned that. It was in French, so Yogi might be the first guy to have said it in English. But the fact of the matter is, since 1937, we knew that the future was not what it used to be. Part of the reason the future is uncertain is because we haven't really encountered this before. Dr. Barry certainly mentioned, 100 years ago, we had something similar. Americans were different back then. And certainly we're far more different than we will than we can reflect on even in 2 generations. I mentioned on one of the previous broadcasts how Plymouth itself has changed just in a couple of generations. For the last 50 years, we have grown by 911 people on average every year. That's with people moving out and with pets. For the previous 170 years, folks, we grew by only 67 years. So in time talking about the census, I think it's important to know how Plymouth has changed so rapidly in the last several years, and really why. It's partly because of the new technologies and the new types of investment here, namely Pilgrim. Well, as Pilgrim is departing, some of the things that the foundation is working toward is to attract new types of industries that have been percolating under the radar for the most part, but for myriad reasons, they haven't been able to break through. Well, the fact of the matter is now is the time where they're actually finding themselves breaking through. High unemployment actually does offer some benefit in some industries in that people are now able to pivot. For a sector that you weren't necessarily interested in before, you had an opportunity to learn about, and now it's far more viable than it ever was. So I only really want to mention that not everyone is reporting business is bad. I think it's important for folks to realize that even just a handful of the restaurants I've had the pleasure to talk to over the last couple of weeks, I would say anecdotally, on average, many folks are reporting that March was down. I think we can understand why. That's when we first started to get the first breaths of this corona nonsense. April, for a lot of folks, seemingly was stagnant. May, for those same folks, is actually up, as high as 20% in some cases. It's not across the board. I understand that. Some businesses have adapted. Some businesses are actually thriving. And one of the themes that we've shared with you throughout these broadcasts is that although it seems incomprehensible to start a business given this climate, now is exactly the time for you to start thinking about the type of business you might want to run and the types of jobs you want to create for your friends and your family. One email I received, and I won't go into great detail reading it, but and I want to maintain anonymity, as we often do and always do, I should say. But there's some things in this email I wanted to pull out, and I hope that in sharing them, it gives folks a great deal of confidence in what they can expect in Plymouth, at least in post and the aftermath. The email starts with, "This is a crazy time. It makes me wonder what it will be like when we get on the other side post-virus. We, this business, have a backlog. I haven't been this busy since the early 80s. I am looking to relocate to Plymouth within the next 3 to 4 months and possibly hire 1 to 2 employees." The email goes on. But I want to share with folks that entrepreneurship is all about creating and overcoming disruptions. The future is uncertain, but the future is what we make it. All we can do right now is establish the guidelines for customers and businesses and the gaps to see how that works. Processes will be replicated once we figure out what works best. There are examples of small businesses reporting sales being up since opening or reopening, and that is partly because they took the strides to adapt. I mentioned on the last broadcast that the Plymouth Economic Recovery Task Force, being headed by the Plymouth Area Chamber of Commerce, we're studying ways that businesses are reporting complications, bottlenecks, impediments. We intend to have several fundraising efforts, which I will get to in the second half of this segment. But please understand, folks, Plymouth, to take some of what Michelle was saying, it's not acceptable to be anything less than the best and the most prepared and the fastest to recover. Because when we do that, we will start to see new types of investment coming into our community. So I look forward to questions and answers, Steve, and thanks so much for the opportunity to be here.
Stephen Cole is the Executive Director of Plymouth Regional Economic Development Foundation. You can send him your questions, plymouthinfo@pactv.org. And as we move on to our daily update from our State Representative Matthew Muratore. Matt, with the reopening, I started the day. I went to a hair salon. I could not go in until they called me in my car. They took my temperature. They gave me hand sanitizer to wipe. So a lot of new protocols, not only for the essential services that we've been following for some time now, but for all the new businesses. I then dropped off an item for jewelry repair. The owner met me at the door. And finally, I went to Verizon to pick up a charger, but I was able to call in advance, pay in advance by credit card, have very limited contact. Matt, welcome.
Hey, Steve. Oh, I look like you got your hair cut, but I was wondering why you didn't get it colored. It still looks like the same white color. So they must have ran out of color.
I have no interest in that. I won't comment about you.
Thank you. Look at it. I know. Look at it, huh? Well, good afternoon, everyone. Hope everyone had a great long weekend. The numbers are looking really, really good. The last time we were on Thursday, we had the number of tests were 7,741, and there were 873 of those that were positive for 11.3%. Yesterday's numbers, there were 8,188 tests, and 596 were positive, so that's 7.3%. So we've dropped 4 percentage points since Thursday when we last talked. When you look at the comparisons from May 20th through May 25th through yesterday, which was the last time we were on, there were another 63,621 tests. Of those tested, 5,346 were confirmed cases for 8.4%. So again, numbers are looking good there. Unfortunately, though, there were another 478 deaths since the last time that we spoke. In Plymouth County, the numbers went up by another 396 of confirmed cases, from 7,198 on Thursday through to 7,594 yesterday. And the deaths went up another 43 in Plymouth County, from 470 to 513. During the same time frame, Plymouth had 397 confirmed cases on last Thursday, and through yesterday, they are now at 509, an increase of 112, with about another 22 increases in deaths to 46 deaths. Now, I know there was an article in the Old Colony over the weekend talking about the increase. I think a lot of the increase has to do with the amount of testing that's being done, particularly in long-term care facilities. And we have over 800 beds in nursing homes. And then if you add the assisted livings on top of that, there's over 1,000 beds in the town of Plymouth. So I think that's what you're seeing is some more testing being done, because the long-term care numbers still continue to rise for confirmed cases as well. With that too, and I think the article mentioned there was only 6 deaths as of May 6th, but that actually wasn't the case. That was more April 6th. But the deaths have more than doubled. Have increased by 22 since last Thursday. So we're still seeing it hit here in Plymouth. BID Plymouth, their cases have gone down though. They now have 42 cases, whereas last week we were talking 76. They're now down to 42 confirmed suspected cases of COVID-19 in BID Plymouth Hospital, with 6 of those in the ICU. If you look at the hospitalization rates, we were running 4% early last week. We are now down to 2%. So the hospital beds filled with COVID patients on Thursday was 2,472. Today it's down to 2,132. So we dropped 340 more patients at the hospital. And the ICU beds have dropped from 672 to 576. Another 96 beds decreased since we were on air last Thursday. Again, talking about long-term care, again, the deaths are almost at 4,000 in long-term care, which is over 60% of the overall deaths. They're at 3,924. In long-term care facilities, again, long-term care facilities defined as skilled nursing facilities, assisted livings, and rest homes. There are 47,019 cases of confirmed cases in 437 facilities. So those numbers continue to grow in our long-term care facilities. The hospitalization, the open beds in hospitals is over 50%. It's about 52% here in the Southeast region as well as the Commonwealth. So there is bed capacity for in hospitals. So if you have preventive care or care that you need, an emergency, there's no reason there's no reason to avoid the hospitals. There's plenty of bed capacity. So please feel free to take advantage of that. If you look at the weighted average, the 7-day weighted average going back to May 1st, with regards to the number of tests, that's dropped by 69%. If you look at the 3-day weighted average of the COVID-19 in hospitals since May 1st, that's dropped 39%. The percentage of hospitals using surge capacity since May 1st has dropped 62%. And the 3-day average of COVID-19 deaths, even though we're still seeing a surge in deaths, the percentage has dropped by 56%. So all these percentages are all looking good. We're looking good for the next phase, which is phase 2, which we're hopefully looking at by June 8th. We hope to hear something from the governor with some guidance either later this week or beginning of next week for phase 2. But I know they're working daily on that, including over the weekend. So we will be getting more updates as those come along. With regard to the unemployment, the numbers for April came out, and we hit an all-time record in Massachusetts, the highest unemployment ever at 15.1%. There were over 623,000 people that lost their job in the month of April. The previous record was 10.1% in January of 1976. So that's how long it's been, and that was at 10%. We're at 15% right now. So the reopening of the economy, happened at a better time now, and we hope again these numbers continue to go in the right direction so we can continue to open up our economy. With regards to, I want to clarify something with regard to outdoor gathering. Now, it is true the governor's order of 10 or fewer people can gather in an enclosed area at one time. However, if you're in the outdoor area, it doesn't prohibit a gathering of less than 10 people. You can have more than 10 people in a gathering in an unenclosed area, whether you're at a park, you're at an athletic field or a parking lot or a beach. What you have to do in any case is maintain the 6 feet and or wear a mask. So just to make sure that we're clear on that. Always, as Dr. Potvin and Sarah are saying, wear the mask, just to be sure that you stay 6 feet away from people. But those are the general rules for outdoor as well. I just want to make sure that was clear to people. Also, with regard to public housing, Plymouth has been awarded some housing money under the Federal CARES Act. I'm not sure the exact amount yet, but Massachusetts received $4.9 million of aid for public housing. $1 million of that is going to Boston, and the other 3.9 is for 12 other cities and towns, Plymouth being one of those. So we should be seeing some public money coming from the CARES Act for the housing. And finally, I wanted to talk a little bit about what Michelle had to say too with regard to the census. When we talked last week, the census numbers for our area were around 63%. Well, they're a little bit better now. They're 63.8%. So we haven't made such a great movement, and she's right there in 6th place. And there's the list of communities of what their numbers are. You've got Plimpton at 76.4, Kingston at 74, Duxbury at 71.2, Carver at 71, and Pembroke at 69.5. And there we are at 63.8. So, and then Marshfield and Bourne follow. I think we can do a lot better. The League of Women Voters is doing an excellent job getting the word out. I know there's something on YouTube from Dave Buckman, a local business guy who put a song together about the census, and it'd be, if you can go on YouTube and find it, you can be inspired by it. But please go on the census 2020 census.gov, and let's get these numbers up so that next week when we report it, that we can be over 70%. Our goal is to try to get to 80% very quickly. If we can do that by June 1st, that'd be great. But if we can get over 70% by next week, that would be ideal. And that's my update for today, Steve.
Thank you. And that is Plymouth Representative Matthew Muratore. He and the other members of our panel are here to answer your questions. Email us at plymouthinfo@pactv.org. And tomorrow we'll be back and we'll be joined by Dr. Mark Wilson. He is Professor Emeritus at the University of Michigan School of Public Health, Department of Epidemiology. Also on Wednesdays, we're joined by Michael Jackman. He is staff at Congressman Bill Keating's office. Heather Cosby, she is a Plymouth CPA. Amy Naples will do our business segment. She is the executive director from the Plymouth Area Chamber of Commerce. And once again, we'll be joined by Selectman Chair Kenneth Tavares, who could not be with us today, and Plymouth Representative Matthew Muratore. We're now going to go to our questions. Our first question is from a viewer, and the viewer writes to us by sending to plymouthinfo@pactv.org. It's from Linda, and her question is, I'm going to go to Barry, and Barry, since Ken's not here, and you are a town official with the Board of Health. The question is it required that Plymouth employees wear a mask at all times? Yesterday, down at the boat ramp, the harbor masters did not wear them. They went to each person launching boats.
Well, the answer to that is pretty clear. We've talked about it before many times. You have to wear a mask at all times when you're around other people, unless you're able to keep at least 6 feet distance. So if the harbor master was not within 6 foot distance of other people he was interacting with, he should have been wearing a mask, yes.
Thank you. And that's Dr. Barry Potvin. He's answering a question from viewer Linda. And each day we go back to each of our panelists and we ask them for a closing statement after they've heard of all the other people on the panel. We're going to go back to Sarah Cloud. Sarah is the Director of Behavioral Health and Social Work at Beth Israel Deaconess. Sarah, what do you want our viewers to remember today? And you need to unmute yourself, Sarah. Sarah Cloud.
All right.
Thank you.
But it works a little bit better that way, yes. So I know initially PPE, including masks, were very hard to come by, and people have become very creative with sewing masks at home that can be worn by the general population. And as we continue to take strides to adapt, as Stephen Cole had talked about, hopefully we'll see a lot more what they're calling communicator masks. I don't know if you've seen those, but we were very fortunate to have about 400 of these donated to the hospital by a local hearing healthcare company. And these communicator masks really help address the communication skills such as lip reading and reading of facial expressions. So first and foremost, I just really want people to remember to be patient and understanding. Give people the benefit of the doubt. Don't assume that the other person is trying to be difficult. They simply may not be able to understand what you're saying. So don't let the frustration get the best of you or the situation. Take a deep breath and remember that communication is paramount to healthy relationships and being able to coexist well with others. Thank you.
Thank you. And that's Sarah Cloud. She's the Director of Behavioral Health and Social Work, Beth Israel Deaconess in Plymouth. We're now going to go back to Dr. Barry Potvin. Barry, what would you like our viewers to remember today in our health segment?
Well, in keeping with the theme of communication with other people, it's kind of sad that we can no longer really shake hands or hug others except those that we directly live with. But there's another way to do it. I'm going to go back to something that Mr. Spock always did on Star Trek, and that's just this. He often showed this, and he always said, live long, and prosper. And that's my wish for everyone watching today and all the panelists. Thank you, Steve.
Thank you. Dr. Barry Potvin is from Yeshiva University, Professor Emeritus and Department of Biology. We're now going to go back to Michelle Bratti. She is the Director of Elder Affairs for the town of Plymouth. Michelle, what else can you add today?
Well, you know, Steve, we talk often about caring for one another, and that comes in all forms. And we certainly, this panel and many other guests have reiterated that message. Speaking directly in regards to elders, though, I do want to make sure that our elders are taken care of. That's part of our mission at the Center for Active Living and as a community as a whole. If you do suspect that an elder has been abused, these are difficult times and these are hard topics, but I wanted to make sure that people knew that if they had concerns about an elder in our community, either being abused or just simply, it's called self-neglect. Sometimes our elders, they may be sad and depressed, and they may not be doing all that they need to do to take care of themselves, given the current situation or just in general. So if you suspect that somebody is abusing an elder or an elder is being abused, or maybe they're not taking optimal care of themselves, there is a hotline that you can call to make sure that that elder is checked on and is safe. And I just wanted to give that number to file a report for elder abuse. It's 1-800-922-2275. That's 1-800-922-2275. And again, this is just you see something or you're feeling like someone's not taking care of themselves, you can always reach out to us. We're here for you. But we want to make sure that seniors aren't kind of falling between the cracks and not taking care of themselves the best that they can. And we want to make sure that they're safe. Thank you.
Thank you, Michelle Bratti, Director of Elder Affairs for the town of Plymouth. And I know that she has been working very hard with our seniors in Plymouth. Now we're going to go back to our business segment. Stephen Cole, what would you like our viewers to remember today as a takeaway?
Well, I think folks at home probably need to know how to use that very dexterous symbol that Dr. Barry used. I can't do that. I frankly can't split my fingers at that point. Michelle can, apparently. What I do want folks to take away today is that this is the kind of community that takes care of itself and its own. So many programs exist to assist businesses that are operating right now to be able to adapt and adjust. There are many other programs that are also existing to help businesses with payroll, of course, as we know, some of the insurance costs. But what's more, for those folks at home who are thinking about whether or not they have a job to go back to, I can't stress enough, now's the time for you to start to think about the type of a business that you want to run, the type of a business that and jobs that you want to create for your friends and family, the types of problems you want to solve for. To lend further to how we as a community come together, I soft launched on the last two broadcasts. I will soft launch again today, that we are having a quarantine hair and beard competition. Steve, you mentioned that you were able to get in. God bless you. Probably be a couple of weeks still before I do. But before our state rep cuts his hair, what we're encouraging folks to do is to take a picture of your quarantine hair or your quarantine beard and submit it to us so that we can judge you accordingly. And the winner will receive a $50 gift card to the Plymouth-based salon or barbershop of their choice. We have a couple of programs or categories that we're fleshing through. The official launch date will be June 1st. Look toward the Old Colony Memorial for news stories, the Chamber of Commerce Facebook page for updates, the Plymouth Foundation website for information. But I want folks, if you're going to get your hair cut between now and say June 30th, take a before and after photo, get ready for this competition. It's a fun way for us to celebrate reintegrating and acclimating back into normalcy, a new normal, if you will. Thanks, Steve.
Thank you, Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation. And thanks to all of our guests today, which includes Sarah Cloud. She is the Director of Behavioral Health and Social Work, Beth Israel Deaconess, Dr. Barry Potvin. He is a Professor Emeritus, Yeshiva University Department of Biology. Michelle Bratti, Director of Elder Affairs, Town of Plymouth Center for Active Living. And now we're going to go back for a closing statement from Plymouth State Representative Matthew Muratore. Matt, what do you want our viewers to remember today?
Well, first of all, I want to thank all the guests that came on today. Great feedback from everyone. Great words of wisdom. And I'm hearing communication, as Dr. Potvin said. It reminds me of when I was a nursing home administrator prior to becoming a state rep. I used to run facilities. I used to do this training course. I used to call it an ACT, ACT, attitude plus communication equals teamwork. And I think if we all can remind ourselves to try to keep the glass half full, have a positive attitude about things, even times are tough, we can still have a positive attitude. That really leads to open and honest communication and dialogue, which translates into teamwork and everyone working together for the greater cause. And I can't think of a better way to end today's show by saying that. Attitude plus communication equaling teamwork, and we will continue to get through this. Again, stay informed by going to mass.gov/COVID-19, or if you've got questions on the reopening, mass.gov/reopening. If you have questions, go to 211. Call 211. If you want text alerts, text COVID-MA to 888-777, or in Spanish, COVID MAESP to 888-777. Or if you have questions on your health, go to bowie.com/mass if you have any questions on your health. So to continue to stay informed. If you're over 65, please stay home. Again, the higher 95% of the deaths are happening in that age group. So continue to do that. But heed the warnings that everyone has been saying, including Dr. Potvin, who indicated wear the mask at all times. If you're outdoors, it's just safe to wear it. At least 6 feet apart, but at least wear the mask as well. And if for all those folks that are working out there to take care of our physical health, we thank you. And for all those taking care of our economic health, we thank you as well. So the more we come together by staying apart, the faster we'll get back to the people we love and the things we love to do. So we'll talk to you again tomorrow, Steve.
Thank you, Plymouth State Representative Matthew Muratore. Tomorrow again, we'll be joined by Ken Tavares, Chair of the Plymouth Board of Selectmen, also Dr. Mark Wilson. He is Professor Emeritus, University of Michigan School of Public Health, Department of Epidemiology. Michael Jackman, he is on staff at Congressman Bill Keating's office. Heather Cosby is a Plymouth CPA. Amy Naples is the Executive Director for the Plymouth Area Chamber of Commerce, and of course, Representative Matthew Muratore. I'm Steve Triffletti, Plymouth Town Moderator. We thank you for joining us. Good day.